Okay, just to give a quick intro, we are very fortunate to have two of the doctors on the front lines of COVID-19, including Dr. Seemal Mumtaz and Dr. Shabana Siddiqui. Just to set the stage here that this is a session being recorded and will be made available to the broader folks on the network. We will be going through the discussion and question that I've already gotten. We will not be able to take live questions unless those are typed in the chat box. If we have time, we may be able to get to those questions. So with that in mind, I think let's get started. So just to start out with, to introduce our guests here, Dr. Seemal Mumtaz. She is a cardiothoracic and vascular surgeon at CVTS Medical Group in San Diego. She performs cardiac surgeries, including bypass surgeries, transcatheter valve replacements, thoracic surgery for lung cancer and other lung disorders, including robotic surgery. Dr. Mumtaz graduated from the Khan University Medical School in Karachi, Pakistan. She did her surgical residency in Omaha, Nebraska, and cardiothoracic surgery specialty at the University of California, San Diego. She further did a super fellowship in minimally invasive thoracic surgery prior to returning to San Diego. She is a diplomat of the American Board of Thoracic Surgery and being the 254th female surgeon to be certified by the board since 1961. So it's a pleasure to have you here on this session, Dr. Seemal. Dr. Shabana Siddiqui is a hospitalist physician in San Diego. She attended the University of South Carolina School of Medicine and completed her training in internal medicine in Chicago, Illinois. She has been practicing internal medicine for more than 12 years. So with that, I wanted to get started. I think first of all, I think kudos to you guys who are on the front lines of this pandemic and putting your lives and in case in your family's life, it's on the line in terms of treating the patient. So kudos to you on that. I think maybe I can get started. I'm curious to know, how well equipped you guys are in terms of, staying safe yourself when you are out and treating patients with the COVID-19, and how do you make sure that your families are also safe? Do you have any comments on that?
Sure. I guess I'll start. Good evening, everyone. Thank you for having us as a part of this webinar. So with regards to this pandemic and personal protective equipment, we both work in the hospital setting. So the hospital does provide us with adequate personal protective equipment. Whenever we go into a patient's room with COVID-19, we put on an N95 mask, we have gowns, we have face shields, we have gloves, we have hairnets. So we are fully protected when we go into a patient's room. And at least with the hospital that I work at, we do get weekly briefings on how much protective equipment we have, do we have any shortages, that sort of thing. So we're always kept up to date on that. And they do let us know what the shortages are and what they expect to get at the county level, at the state level. So with regards to taking care of hospitalized patients, we are well equipped and we do have the equipment. With regards to our families, so when I come home after working at the hospital, I make sure to, take off the clothing that I was wearing at work and then of course sanitize my hands, wash my hands, and then immediately take a shower. So that's kind of what my experience is. So
Right.
I agree with Shabana that initially there was a lot of scare in terms of PPE available to doctors, and on the East Coast we saw when initially they were not careful with PPE, a lot of healthcare workers did get sick, but we learned from that, and now we stay ahead of the PPE supply. The county is keeping a tab of that as well, and that is one of the triggers for San Diego County, that if we don't have 14-day supply of PPE for about 80% of the hospitals, then things may have to be scaled back. So far that's going pretty well. In the hospital setting as well, we're very careful, and when we put something on, when we take something off, there are protocols in place on how to remove all the stuff that we put on before we leave a patient's room. Things are being done to the best of our abilities in the hospital. In fact, there are a couple of studies that happened to evaluate how well PPE is working for the healthcare workers. And in San Diego County, 2 studies were done by different healthcare systems, and the rate of infection of healthcare workers is very low. It's about 0.1% or so. So the we know for sure that we are high-risk people who are seeing patients with COVID-19, but we're not getting infected as long as we use appropriate PPE.
Great. That's really good to hear. So I think I wanted to understand maybe Seemal, you can describe how it is right now on the front lines. What is the latest in terms of patients coming in? Can you give us a snapshot of how things are right now from your side?
Sure. Yeah. So, unfortunately, things were really bad when we saw the peak in California. Definitely the governor's orders, the stay-at-home orders helped us flatten the curve. But as things started opening, we started seeing a surge. And at this point, we are reaching a peak. And in the next 2 weeks, we're expecting to reach a peak that will most likely be higher than the peak we saw previously. The ICUs are getting fuller within the last week and a half or so. There's a nursing shortage. When New York got hit, there was a nursing shortage in New York, New England area, and a lot of the traveler nurses went to that area. Currently, there is nursing shortages in the whole of Southwest, Arizona, Florida, Texas, California. And the shortage of ICU nursing is probably one of the biggest limiting factor in how we can continue other kinds of surgeries, let's say for people who require a hospital stay or ICU stay. So currently, in terms of the number of cases, things are on the rise. And for San Diego County, we're expecting to see a second peak. The good news is we do know a little more about the disease than we did in March and April. We're a little bit better prepared, learning from our European colleagues, learning from our colleagues in New England, in New York, New Jersey, Connecticut. And there has been a lot of international and national collaboration as well, where people are trying to, we've never seen that until this pandemic, where people are sharing information very rapidly. People are, anything that works, people are, trying to get it out in print. We're running into scenarios where people are seeing rare forms of the disease, and within the medical circles, they are discussing that, and the information is getting spread pretty widely. I'll give it over to Shabana to say what she is seeing on her end in terms of current status as well.
right. So I'm a hospitalist physician, so I take care of mild, moderate to severe cases of COVID-19. And I think compared to March and April, what we've seen is definitely a rise in COVID-19 cases, not only in San Diego County, but across the state and across the nation as well. And I think that has in part to do with the fact that, we've reopened states. We're seeing a lot more younger patients who are coming in with more severe disease. Previously we were mostly taking care of older patients who had comorbid conditions, but now we're seeing a lot more younger people in their 20s and 30s who are coming in with COVID-19. This is a very scary time for us all, and we do know a lot more about the disease than we did in March and April. We do have more treatments available now, and I think we'll continue to learn more about this disease and how it progresses, and what we can do to stop the spread of this virus.
Mm-hmm. Seemal, one thing you mentioned about the shortage of nurses, because I was just thinking that we had heard that actually a lot of the staff, because people have stopped going, or unless it is really needed to stop going to the hospitals, that a lot of the staff has been put on furlough and all. But I think what you mentioned is specific to the ICU nurses. Is that correct?
Correct. So that's the thing. There's a disparity. Not any nurse can start taking care of ICU patients. They have to go through extra years of training, have to spend extra number of hours in the ICU to be able to take care of an ICU nurse. The people who were being furloughed were people who worked in the perioperative area. So the nurses who were in the perioperative area, when elective surgery had stopped, at that time the perioperative nursing staff was furloughed because there were no surgeries happening. The operating room staff was not doing enough work. But on the other hand, the ICU nurses who are needed to take care of the ICU patients were short-staffed even when the elective, so-called elective surgeries were on hold. But now that we have to start doing these surgeries, they cannot be put off forever. There is definitely a shortage of ICU nurses.
Okay.
And there's a larger number of ICU nurses because people in the intensive care unit have to be looked after more closely. So generally speaking, one ICU nurse can take care of 2 patients. If they're not in the ICU on other floors, one ICU nurse can usually take care of up to 4 patients. So you need at a given point in time for, let's say, 24 ICU patients, to take good care of those 24 sick ICU patients, you need 12 nurses. And with the number of ICU patients increasing, that has come to the forefront that we need more ICU nurses.
Okay. So I think going to Dr. Shabana, in terms of the hospitalizations and all, I think some of the questions that folks have is, okay, first of all, is it safe to go to the hospital at this time? Because a lot of people are even wary to go to the hospital.
Sure, definitely. That's a good question. It is definitely safe to go to the hospital, and you should go to the hospital if you are having any sort of symptoms that are not normal to you, chest pain, trouble breathing, or you have other comorbid conditions that need to be evaluated. So it is entirely safe to go to the hospital. COVID-19 patients, when they come to the hospital, they are immediately isolated and they get sent to a separate room. And the nurses have to put on their protective equipment. We as doctors have to put on protective equipment, and we take off all that protective equipment when we're done seeing the patients. Every patient that gets admitted to the hospital has to wear a mask, and they do get a COVID-19 PCR test, okay? And whoever tests positive, of course, they're automatically isolated. So other patients are not coming into contact with that patient. Okay. I've had, a couple of patients who have told me that they did not come to the hospital sooner because they were scared of coronavirus, of catching it. And I had to reassure them that, that should not be the fear. The hospital is one place where we know who's positive and who's negative, and we separate the patients who are positive from those who are negative.
Right, right.
Anna, you also want to comment on if people delay coming to the hospital?
Oh, yes. And, you know, that has happened. There are patients who, because of their fear of coronavirus, will not come to the hospital and they'll delay their care, especially somebody who's having chest pain or who's having a heart attack, somebody who's having a stroke. You know, in these situations, getting to the hospital on time is of crucial importance in order for them to get the care they need. And we've seen that patients who don't show up to the hospital on time have worse outcomes, you know. So we want to stress that, please, if you know you have something that's going on that you know is abnormal and you have comorbid conditions, you definitely need to go to the hospital to get checked out. Yeah, please don't wait.
Right. So you know, if somebody is fearful of, you know, that he may have acquired that, and even before they have had a chance to do any COVID testing, and if their symptoms are severe, they should just go to the hospital at this time, or what are the guidelines in terms of, I think, when somebody should actually be going to the hospital?
You mean with COVID-19 symptoms?
Yeah, with COVID-19 symptoms, you know, if somebody is suspecting, you're saying that the hospital would do the test, right?
Yes.
So there's no requirement that somebody be doing the test if they're suspecting, and only if they're positive, and then they would go. You're saying that if somebody has some severe symptom, they should just right away go to the hospital, right?
Oh, definitely. I think if you're having, you know, chest pain, shortness of breath, you should definitely go to the hospital to get checked out. If you have mild symptoms, fever, cough, headaches, weakness, I don't think there's necessarily a need to go to the hospital in that situation, but you can get tested for coronavirus. There are several coronavirus testing centers. If you go to the San Diego County Public Health Department and you type in your zip code, you can find a center that's closest to you where you can get tested. But definitely, if you are someone who has underlying comorbidities, for example, heart disease, diabetes, blood pressure, and you're having shortness of breath or chest pain, and you suspect you may have COVID-19, then yes, you should go to the emergency room to get checked out and tested.
Right. So, so I think once somebody has been determined, yeah, you know, that has COVID and gets admitted into the hospital, not in intensive care, but I think the unit that you are working in,
Right.
then what type of treatments are available? Can you talk about that?
Sure. So I admit patients who vary in age from 20 to 90. They have either mild, moderate, or severe disease. They mostly present with shortness of breath when they come in with COVID-19, and they may or may not require oxygen. So with these patients, it kind of just depends on kind of what their symptoms are, what their vital signs are, their blood pressure, their heart rate, their oxygen levels. We do have treatments for COVID-19 now. A couple of treatments that I'll mention: remdesivir, which is an antiviral treatment. We have that. We have plasma treatment, which is more in the critically ill patients. And then we also use steroids. So what I decide to start a patient on kind of depends on what kind of symptoms they're presenting with, how long they've had the symptoms, and, you know, are they requiring oxygen or not? So several different factors go into determining what treatment I would start on the patient. And, you know, I just want to put it out there, these are not cures for coronavirus. These are just treatments that studies have been done on these treatments, and we do find some benefit with these treatments. But at this time, there is no cure, there is no vaccine. And there are several clinical trials currently underway with multiple other treatments that they're looking at. So that's kind of where we are at this point, and I think we still have a long way to go to figure out what else will work against this virus.
Sure. So are there specific guidelines in that respect that you follow for the treatments?
Yes. So the guidelines we follow, we do look at WHO, CDC, at least in the United States, we follow the CDC guidelines. And then San Diego County has its own guidelines, the public health department, and each hospital puts forth their own set of guidelines based on the CDC and the county guidelines. So for example, the hospital I work at, or the healthcare system I work at, we have a set of guidelines for managing and treating COVID-19 patients. And we try to follow those guidelines. And those guidelines can change, on a weekly basis, just because we are learning so much about this virus and what works and what doesn't work.
Right. Okay. So what happens typically? How long does a patient remain in that care, assuming that the patient starts to get better and doesn't have to go into ICU?
Sure.
How long typically the patient remains, and then what happens to the patient once the patient gets discharged?
Sure. So how long the patient stays in the hospital is determined entirely by their symptoms, their vital signs, their oxygen levels, that sort of thing, how they're doing. So if I have somebody who has severe COVID-19, then that person eventually will end up in the ICU. For the mild and moderate cases, they can go home the next day, or they can go home within 5 days, 7 days. It just kind of depends on how their disease is progressing. Typically what I've done is I, try to find out from the patient at what are since the onset of their symptoms. We've noticed that by about week 2, so day 7 through 10 is when a lot of patients kind of go downhill, and they may crash. And I think you've heard of the term cytokine storm. And so I try to watch patients during that period to ensure that they are not going downhill or deteriorating. And then, if they are not deteriorating, then that's a good sign, and hopefully they can go home. So it varies. It depends on person to person, how the virus has affected, them.
Right, but once the patients are discharged, they're still supposed to quarantine themselves or
Yes.
isolate themselves from their families, right?
Correct, right. So at discharge, when we discharge a patient, we educate them about what they need to do when they go home. They do need to isolate, quarantine themselves from other family members who live in the home. And we ask that they, always wear a mask, practice good hand hygiene, social distancing, that sort of thing. And if they do need groceries and, other supplies, then we do guide them that maybe a neighbor, family member can help out with respect to that. And then we do tell them that if they notice that their symptoms are getting worse, that they need to come back to the emergency room to be evaluated, because we do have patients who we admit to the hospital, they do well for a few days, they go home, and then they do come back with worsening of symptoms. So we tell them to watch out for, any worsening of their symptoms and to come back if they need to.
Okay. So let's go to Dr. Seemal. In terms of the, from your, view in terms of the ICU patients, what is the mortality rate in terms of the patients that are actually gone to the point that they have to be admitted to the ICU?
So the overall, for patients who are admitted to the hospital, about 20% people die. They don't make it out of the hospital. This is for San Diego County. For the ICU, I don't have an exact number for the ICU, but there's definitely people who come into the ICU, and that's why they come to the ICU, where critical care in this day and age is very advanced. There's a lot of different treatments that can be offered to patients in the ICU. If a patient is deteriorating while on the floor, or when they come through the emergency room, they're already in a state of severe respiratory distress. They come into the ICU. And even in the ICU, we try to see if they can, with medical management, with supplemental oxygen, with high levels of supplemental oxygen, if we can avoid an intubation. but a large number of people do end up needing to be intubated, meaning have a breathing tube in through their nose, be on the ventilator, connected to a machine that's doing the work of breathing for them and giving them 100% oxygen. As you know, room air oxygen is 21%. And so with the ventilator, we can deliver up to 100% oxygen. In terms of the treatments that are available that we provide in the intensive care unit, I think the general public does not know that there are treatment strategies even past the ventilator, that's not just the only thing. There are, these specialized beds that are made that we can place a person who is intubated in the prone position, meaning kind of on their belly. And what that does is it helps it recruit some of the lungs in the back of the chest that, generally speaking, people laying on their backs are not able to utilize as much. And that sometimes help their oxygen levels to where we can, keep them there for a few days. Some of them stay in that position for a longer period of time and eventually start to improve. Some of them don't improve even with that. And at that point, we have some strict criteria to do it, but it's a very invasive thing that for very select few people that we can sometimes do is called ECMO, where we put them on a cardiopulmonary bypass machine. There are big cannulas that are put inside, and we take the blood out of the person's body and run it through a machine that delivers oxygen directly into the blood, kind of bypassing the area of the lung, the damaged lung, and then give that blood back into the body, so that even though the lungs are not able to provide the blood with oxygen, this machine is providing the blood, oxygen-rich blood that then goes to the kidneys, livers, brain, all of those things to decrease the risk of injury to other organs of the body. And I'll tell you, even with that, and in Europe they tried it, in Italy they tried it, in France they tried it. Even with that, the mortality is still very high. It's still about 40 to 50% mortality. But there's different ways for us to escalate treatment even in the intensive care unit. And then there are people who actually start to improve even on the ventilator. Unfortunately, the way it is COVID can cause pretty long-lasting effects on the lungs. And even if the lungs do start getting better and we don't have to escalate it to needing the lung bypass machine, even then, we can't leave people with the breathing tube in through their mouth for a long period of time. So sometimes we have to do surgery in order to put the tube directly through the neck to make it more comfortable for the person, to make it a little easier. That helps sometimes with coming off of the ventilator as well. So those are the kinds of treatments that we are able to offer in the ICU. I think someone had brought up at one point something about convalescent plasma. In the beginning, we were using it a lot more because we had very little other options, and we're still using it in the critically ill patients. But all of that is done under a clinical study. So people have to meet criteria. If they meet criteria, they get enrolled into the study so that we can learn who are the people who are benefiting from this, who are the people who are not benefiting from this. And as a medical community, we can learn what the, who to use it for going forward.
Right.
And these are treatments and not cures. These are treatments to help people get through this acute phase of illness so that they're alive at the end of the illness.
Okay. Yeah. Things are pretty. So, I think this blood treatment that you talked about is past the ventilator, where you're provided blood, oxygen-rich blood to ensure that your organs don't get damaged. Correct?
It's more complicated than that. Like, it's much more complicated than that. But yeah, it's essentially the heart-lung machine that when we do open heart surgery, that's what we use when the heart is stopped. The heart-lung machine does the work of the heart and the lungs while the heart is off. And so in very critically ill patients who have a good chance of survival overall, don't have too many other comorbidities, in those very select people, it's like the last resort that we can pull out of what we already have available. It's very invasive. It requires a lot of blood thinning, but again, as physicians, as doctors, as the medical community, we have pulled every trick or technique out of our trick bag to try to help these people along.
Right. By the way, I think back in early stages, back in March, I believe there was a lot of, hue and cry on that there's going to be, there was a fear that there's going to be a shortage of ventilators with the number of COVID cases rising. How's that looking? Because I think that now we are okay. I don't hear of the shortage anymore.
So I think there was this concern that there may be a shortage. All the hospitals, are keeping a tally of how many ICU or how many vents they have. There's something called disaster vents. There's something called anesthesia vents, and the county, at least for San Diego, is doing a very good job on every day getting a tally from all the hospitals on how many vents are being used. And again, for the San Diego County health officer, that is one of the triggers, that how many vents are being used and how many vents do we have available. And if at any point the hospital or medical community doesn't feel we have enough vents available, the health order may change in terms of the stay-at-home orders or what all can be done. I do know that I believe in Colorado at the initial point of the surge, and some other places as well, they converted operating rooms into ICUs and used the operating room ventilators to, put patients on the vents. In New York, there was definitely, a shortage of that. In San Diego, it seems like we're so far doing okay in terms of the number of ventilators, but right away in March, any ventilator that was like, even the really old ventilators, I saw ventilators that I probably saw when I was a medical student, that were like out, and the biomed department that fixes the machines in the hospital, they just got every vent that could possibly be used, got it out into the ICUs to be able to be used. To increase the capacity. So far, we're doing okay, but again, like I was saying in the beginning, that we are seeing a second peak of this first surge that we have. And if we're seeing, or a second surge and the first peak, whichever way you want to call it. We're hoping that, it peaks before we run out of ventilators.
Hopefully, yeah. And one more thing that we heard also was that, I don't know how true it was, that ventilators in some cases can cause more harm than good. I don't know, has there been any update in terms of the guidelines on the use of ventilators?
I don't, it's a myth, like wherever that's coming from is a myth. I think in the initial days of COVID, there was some talk about doing what we call early intubation, meaning the threshold for when we put a breathing tube in someone in different kinds of diseases and different patients is usually different. And so there was a discussion going on, or should we do it earlier on? And some of that was to prevent the aerosols from spreading everywhere. Some of that was to do it in a controlled setting, in a crashing setting. And the consensus pretty early on was that we don't need to rush into intubating people. But this whole myth that ventilators can be harmful is a complete myth. These people, like if you were not putting people on ventilators, your mortality rate would be through the roof. People would not survive past a day or two. The people who go on the ventilators, because like I told you, I mean, it's not just that, we just put them on the ventilator and that's it. No, we have to put them on the ventilator and still their oxygen is low. We go up to 100% oxygen and still their oxygen is low. We have to give them increased amount of pressure to push through the lungs and still their oxygen level is low. Then we have to put them in the prone position, and sometimes their oxygen gets better, sometimes it doesn't get better. It's without the ventilator, there isn't critical care outcomes wouldn't be where they are, not just for COVID, for any kind of illness. They would not be where they are without the ventilator. The ventilator is everyone's friend.
Right.
So anyone who ever needs to be on a ventilator wants to be on a ventilator. Like,
Thanks.
do not
Thanks
fight.
Yeah, thanks for setting that the record straight on that. So one other thing I was reading is that this Dexamethasone is, I think there was some Oxford study or some, is that still in trial phase, or that's something that have already started being used as a treatment?
So dexamethasone is a steroid, and that is something that the critical care doctors have been using for a while in lung injury, in people who come in with really bad pneumonia, who are on the ventilators, in people with influenza, even when they have really bad lung injury at times. And it has been used. It's been studied for decades. It's a very old medicine. And it has been used in COVID-19 as well in the United States, probably from the get-go, just the way the other tips and tricks that, like I was saying, that doctors have taken out of their pockets and used everything that we can use that we think may help the COVID patient. So the UK did what they did good is in the recovery trial, they're studying everyone, all these tips and tricks that everyone else is also using. They're just studying them, and they were able to give some good evidence that in the critically ill patients, steroids work. Like even though their study is talking about dexamethasone, it's not only about the dexamethasone, it's about the steroids. That in the critically ill patients, steroids seemed like they helped them. So it wasn't that they started a trial to study dexamethasone. Dexamethasone is a drug that is used in conjunction with other things, sometimes in critically ill patients on the ventilator. And so, like all other critically ill patients on the ventilator with bad lung injury, they continued to give it. And when they looked back at those patients, they were able to see a mortality benefit. And so it has been used. It has now become of treatment protocols, I believe, almost everywhere, for the critically ill patients only. Because it is a steroid, it can cause some immunosuppression. So people can't be just taking it on their own, or taking it in the non-critical setting. There are specific criteria with specific cutoffs at which you start them, because those are the people who benefit from it, but others do not benefit from it. In fact, it could lead to more problems in other people who are not critically ill.
Okay, great. Let's shift the gear a little bit. Now, just to let the audience know that if you guys have any questions, you can go ahead and type it in the chat box, and we will try to get to those towards the end. But I want to shift the gear and talk about the prevention side. And if you guys have any advice that you can offer to the folks, and I'm assuming that most of the folks here, the audience, are healthy and have in that case, what would be your advice to stay healthy and to avoid getting infected?
I think it's going to be mask, mask, mask. Keep a mask on, put a mask on, wash your hands, like hand hygiene, masking, social distancing. Those are the only three things, even more important than dexamethasone, that we do know for sure work. Like I told you, the healthcare worker study, only 0.1% were positive. So with appropriate PPE, mask, hand hygiene, and social distance, physical distance, we can really be very careful and prevent getting it from other people, giving it to other people. That's very important. So with this second surge happening, I would really say try to minimize the number of essential things that you have to do. Try to minimize when you're interacting with other people, of being indoors. If people have to do grocery runs, spread them out, like get enough stuff to last you 2 weeks so that you don't have to go back to the grocery store for another 2 weeks. If you're meeting someone, try to meet on outdoors. Currently, I think we have 27 outbreaks in San Diego County of COVID-19, and 24 of them originated in an indoor setting. In restaurants and bars, because the masks come off while you're eating food, even if you're 6 feet apart, it's a closed space, you're breathing the same air. I mean, what the county is doing about creating outdoor spaces is better than indoor spaces, but even then, with the current surge, you don't know who's walking out on the street, who's already positive, and either they know about it, or either they don't know about it, or some of them even may know about it. I mean, Dr. Siddiqui was telling me about a couple of patients that she's had who were positive in the hospital, and they left the hospital against medical advice.
Yes.
Someone who was supposed to be hospitalized left the hospital against medical advice.
And there's no tracking for those?
No, there is. So, so yes, I've had a couple of patients who have decided that they no longer need to stay in the hospital, and they were COVID positive, and they did end up leaving against medical advice. And we report those patients. Those patients are already on, San Diego County Public Health Department's tracking list. So anytime a positive patient shows up in the hospital and is tested positive, they are made aware of that patient, and they do follow the patient after discharge. So the couple of patients who left against medical advice, we notify San Diego County Public Health Department that this patient has left. And so they will, contact that patient and make sure they're following isolation, quarantine instructions, that sort of thing. So yeah, so that's true. You don't know when you go to the grocery store who's walking around with COVID-19. So it's a very scary thing, so we all need to be vigilant. We all need to wear our masks, wash our hands, socially distance, avoid large gatherings as much as possible. Because I think a lot of these community outbreaks that have happened as a result of large gatherings, where people are going to birthday parties, family events. I can't tell you how many patients I've admitted for other reasons who have told me, oh, I was recently at a family gathering, and I kind of look at them in shock and say, why are you doing that, Or I ask them, do you have a mask? And most of the time they say no. So, I think we really need to be vigilant. This virus is spreading rampantly. And in order to contain it, we need to stress the importance of wearing masks and, avoid gatherings and socially distancing. This is what we have in our arsenal at this point.
Right. And I think what Seemal was mentioning is that avoid the indoor gatherings as much as possible. I was just curious, now that it's the peak of summer and people are heading to the beaches. One of the hot areas I know where the spread has been there is Pacific Beach, PB area, but I'm not sure if it is actually going to the beach, or is it more like the bars that are in that area and all. I don't know if you can comment on that, if you have any.
I think it's probably a combination of both. From what I've heard from coworkers is that they've seen several people who go to the beaches and are not wearing masks. And with, for example, the 4th of July weekend, I think the beaches were open in San Diego, and I heard they were packed. And how are you supposed to socially distance on a beach, when it's packed, when every inch is taken up, so, and then also the bars, yes, going to bars and indoor gatherings, I think increases your risk for getting coronavirus. So I think it's a combination of those things that why we're seeing such a increase in number of cases. Things have reopened up. San Diego beaches were open this past weekend. The 4th of July weekend. And, I think we might see a larger number of cases in the next 2 weeks because of that.
Yeah, that's
the outdoor setting also, like what I was trying to allude to is that, staying at home can lead to social isolation. For some of the elderly, it's hard to continue that social isolation for 6 months, because this is not going anywhere anytime soon. So if you want to go see your parents, if you want to, avoid a gathering indoors, If you want to go see your parents, stay outside, stay outdoors. You keep your mask on. They keep their mask on. Don't involve food, even though it's very hard to like go meet someone and not involve food in that. But try to, if you can, not involve food, so that everyone can keep their masks on. And if you do end up involving food, make your distance even more than 6 feet so that you're far from each other while you're not wearing masks. But if you're even going to go meet someone, one person that you know has been quarantining as well as you have, or one family, just be distant from them. Be outside is better than being indoors. Going to restaurants, sitting is okay, like taking takeout food from restaurants, but sitting inside restaurants, I mean, it's not happening anymore, but sitting inside restaurants in an enclosed space, or going furniture shopping in an enclosed space, not good ideas.
Right, right. And I think one of the things, because I think mostly what I'm hearing is that it's the contact with other people that is the cause for the spread. What about like people sanitizing groceries or any object that comes from the outside? Is there any still evidence that it spread through objects as well?
There can be it's called fomite spread, that, the virus goes on inanimate subject or inanimate surface. And then once that inanimate surface is touched by other people, that gets on their hands. So there are ways to curb it. And the ways to curb it would be to wash your hands frequently. Don't touch your face if you don't have to wear a mask. And if you want to wipe down the, inanimate surface, well and good, whatever kind of works for you, but washing hands at the end of the day is going to be the most important thing to prevent that fomite spread. Keeping your workspace clean, keeping your house clean, cleaning the high touch surfaces more than, is probably the most important thing.
Right, like cleaning doorknobs, kitchen surfaces, anything that you touch frequently, but always making sure you also wash your hands. That's probably the most important thing you can do.
Yeah, I think we're washing our hands like 1,000 times a day.
Yes, we are.
Yeah, that's a new habit that I think probably will stay for a long time.
It's not very new to the hospital. I mean, in the hospital, we've always had to, we always wash hands. You go in before going into a patient's room, you wash hands. After you come out of the patient's room, you wash hands. If you go to a hospital, there's hand sanitizer dispensers everywhere. But
for us common people, I'm saying that.
Yeah, definitely. It will help prevent spread of other illnesses as well, other communicable diseases as well. The influenza, definitely other communicable diseases too.
Right. So because people are at home and are spending so much time on social media and all, what's your take on all these desi totkas, what we call, which are rampant on the WhatsApp and other social media, you hear that garlic or turmeric, they are good in terms of the immune system. They're good for the immune system against coronavirus. Any comments on that?
It's interesting. Like, these are a lot of myths. They have not really been studied. In fact, I mean, since March, I think probably 100,000 different things have come out that can help boost your immunity, but obviously nothing is really working. So you can eat as much garlic and turmeric as you want to. If you're not wearing your mask, it doesn't matter. You're in contact with a coronavirus patient, you're getting the coronavirus. You can do things that you want to make sure you're staying healthy, make sure you're staying active, make sure you're taking care of your mental health as well. Your stress levels are not that high. You can do those, things if you like the taste of turmeric and you want to take turmeric and it helps you. It may be a placebo, but okay. But some of the things are actually can be harmful, and those you have to be very wary of, even though they may sound like there's nothing wrong with using them, like putting things in your nose is not going to kill coronavirus, or gargling with random things is not going to kill coronavirus. You may end up choking on things, you may end up inhaling things through your nose that then go into your lungs and cause other kinds of problems. And definitely don't just follow WhatsApp doctors, like people who are not doctors and are just giving free advice to the whole world. If any of these things worked so well, like we would have stopped in March. But the things that do work are masking, hand washing, keeping your distance, not being indoors with other people of unknown disease positivity or not without a mask.
Right.
Yeah, then I just wanted to say that we want to stress to everyone to please get your information from reliable sources and from experts, not from what's being put out there on WhatsApp. And right. I know my parents are guilty of that.
Yeah, there's too much. I think it's information overload, and,
right.
and where people kind of lose the sight of the source, and especially WhatsApp is the problem is that often you keep forwarding stuff and you can't even trace the origin or the source of that news.
Yeah, so if you get any video from someone saying, "Oh, I'm a doctor and I am giving this advice," listen to whatever their name is, Google their name. I have been forwarded things from family and friends that, "Oh, Dr. So-and-so said this, Dr. So-and-so said ventilators are bad." And I Google them and they're like, they have either an MD or a DO degree, but they are people who are working in medical spas or urgent care and have never set foot in the hospital. Or they are doctors who have not practiced medicine in 15 years and they have a side business, but just because they have the title of a doctor, they're putting out videos and no one's questioning them. And so all you have to do is Google that person's name. Or I have seen doctors who, these videos related, when I Google their names, the first thing that comes up is, "Oh, Texas Medical Board limited this person's license because of malpractice behavior," or California Medical Board revoked this person's license and this year because they were giving false information to patients, or things of that nature. So you really do not want to be following advice just because someone has the title of a doctor. You can Google my name and you can confirm that I'm a cardiothoracic surgeon in San Diego, California. You can Google Dr. Siddiqui's name and you will confirm that she is a hospitalist with Sharp Healthcare. So confirm first before forwarding something, because we have to remember this information can actually be harmful if you forward it without verifying, because verification is necessary even for the lay people. Verification is necessary. Otherwise, you inadvertently may end up harming someone.
Right. So I think one more question that I've gotten, and a lot of it's on a lot of people's mind, is that where can we get COVID testing done? Because from what I have experienced, when I had an elderly person at home, also is that when you have some symptoms, even if it is just a sore throat and cough, you want to make sure that you don't have that, because if you are sharing the same house with an elderly person, but when you go online and try to get appointments and all, it just takes forever, and the results take forever. Any advice on the testing?
So I get that question a lot in the hospital, especially from family members of patients who have tested positive. So the San Diego County Public Health Department has a website, and I looked on it myself and you put in your zip code and it'll give you a list of places where you can go get free COVID-19 testing done. Some of these places do require appointments. And if the line is long or the appointments are too many, you can also, all of the major hospitals have tents set up. At least the hospital I work at has a tent set up right in front of the emergency room. If you're having symptoms, you can also go there and get tested as well. And then just yesterday, I saw that with the hospital I work at, a nearby gym parking lot was set up as a testing center. So there are lots of testing centers around. So hopefully you would be able to go get a test. And at this point, you know, you don't necessarily need to have full-blown symptoms in order to go get tested. If you have mild symptoms, you can go get tested. If you are in contact with someone who you knew had coronavirus, you can go get tested. So I would say refer to the San Diego County Public Health Department website. And if they do have a lot of options on there, and if none of those work out, then each major hospital, they do have tents set up where testing is done.
So that's where you can just drop in without an appointment, you're saying?
Yes, yes.
Okay.
Also, I think there's a number like 211. That's the COVID helpline. You can call that, and they will guide you to where you can go as well. So people who are not tech savvy, who don't have access to a computer or have difficulty with that. I mean, nowadays everyone almost has Google Maps. You can even go on Google Maps and just type in COVID testing, and they have you know, highlighted the areas on Google Maps where you can go and get tested, and it says in front of those places where you need an appointment and where you do not need an appointment.
And then with regards to the when you get your results, so in the hospital, you know, the results are pretty quick. We get them within 24 hours. Outside of the hospital, I've heard up to 72 hours, so like 3 to 4 days maybe. But I don't think anything longer than that. But however, in the beginning, like in March and April, it was taking some people like almost a week to get their results. But that's all changed now. We have more testing capacity. We have several labs that are doing these tests, so the turnaround time is a lot quicker now.
That's great, because I think CVS has probably 5 to 6 days. That's what they say on their website for the results. And I don't know how soon you can find an appointment day, but I think that it looks like the county has probably now is in a better shape for the test.
Yeah,
okay.
Definitely.
Excellent. Okay, great. I think we are almost out of time. I want to thank you both to take time out, Dr. Mumtaz and Dr. Siddiqui, from your busy schedules to enlighten us on this crisis. We definitely are hoping that this spike of cases is a quick one and it comes down, but we definitely appreciate, salute to you guys who are on the front lines fighting this, and just wanted to express our appreciation for that. Thank you very much.
Thank you.
Well, thank you so much.
Thank you everybody for joining the session. Bye.